CNA Final Exam Review 100 questions. Flashcard 1. What is one important reason why bed linen should remain wrinkle-free? Think of the answer before the reveal. The answer is to help keep the skin healthy and prevent pressure ulcers. Flashcard 2. What is the term for a device that replaces a missing body part? Think of the answer before the reveal. The answer is prosthesis. Flashcard 3. Exercises that put each joint through its full arc of motion are called. Think of the answer before the reveal. The answer is range of motion. Flashcard 4. Which of the following is the correct way to remove a gown? Think of the answer before the reveal. The answer is unfasten gown at neck and waist and roll the dirty side in while holding gown away from the body. Flashcard 5. How many times can disposable gloves be worn before being discarded? Think of the answer before the reveal. The answer is 1 time. Flashcard 6. To best communicate with a visually impaired resident, the NA should. Think of the answer before the reveal. The answer is identify herself when she enters the room. Flashcard 7. The best way for an NA to provide foot care for a diabetic resident is to. Think of the answer before the reveal. The answer is observe the feet regularly for signs of sores or infection. Flashcard 8. If a resident starts to fall, the best thing an NA can do is to. Think of the answer before the reveal. The answer is widen her stance and bring the resident's body close to her. Flashcard 9. An NA should use friction for at least blank seconds when washing her hands. Think of the answer before the reveal. The answer is 20. Flashcard 10. Which of the following is a term for a legal document that designates what kind of care a person wants if he is unable to make that decision himself? Think of the answer before the reveal. The answer is Advance Directive. Flashcard 11. Which temperature site is generally considered to be the most accurate? Think of the answer before the reveal. The answer is rectum rectal. Flashcard 12. Which of the following tasks is outside the scope of practice for an NA? Think of the answer before the reveal. The answer is prescribing a new medication. Flashcard 13. How should the NA respond if a resident tries to give him a gift? Think of the answer before the reveal. The answer is the NA should refuse the gift but say thank you. Flashcard 14. What does the term empathy mean? Think of the answer before the reveal. The answer is empathy means being able to identify with the feelings of others. Flashcard 15. To monitor a resident's pulse rate, the NA will most commonly check the blank pulse. Think of the answer before the reveal. The answer is radial. Flashcard 16. Slapping, shoving, and rough handling are all considered to be a type of blank. Think of the answer before the reveal. The answer is physical abuse. Flashcard 17. With which of the following people may an NA share a resident's medical information? Think of the answer before the reveal. The answer is resident's doctor. Flashcard 18. Which of the following sentences is an example of a fact? Think of the answer before the reveal. The answer is Mr. Gomez ate half of his scrambled egg. Flashcard 19. Which is / are the most essential nutrients for life? Think of the answer before the reveal. The answer is water. Flashcard 20. Objective information is. Think of the answer before the reveal. The answer is information collected using the senses. Flashcard 21. Which of the following statements is true of documentation? Think of the answer before the reveal. The answer is NAs should document care right after it has been done. Flashcard 22. Standard precautions should be practiced. Think of the answer before the reveal. The answer is on every single person in the NA's care. Flashcard 23. Which of the following statements is true of hand washing? Think of the answer before the reveal. The answer is an NA should wash her hands before and after touching a resident. Flashcard 24. Using proper body mechanics includes. Think of the answer before the reveal. The answer is standing with the legs shoulder width apart. Flashcard 25. What is one of the first signs that a pressure ulcer is forming? Think of the answer before the reveal. The answer is discoloration of the skin. Flashcard 26. Which of the following is an example of a physical need? Think of the answer before the reveal. The answer is food. Flashcard 27. Which of the following remarks is a click, a tilde copyright? Think of the answer before the reveal. The answer is it will all work out in the end. Flashcard 28. In which type of environment do microorganisms grow best? Think of the answer before the reveal. The answer is dark. Flashcard 29. An axillary temperature is measured. Think of the answer before the reveal. The answer is in the orbit. Flashcard 30. If a resident has just had a glass of iced tea, how long should the NA wait before measuring the resident's temperature via the oral method? Think of the answer before the reveal. The answer is 10 to 20 minutes. Flashcard 31. Which of the following abbreviations means nothing by mouth? Think of the answer before the reveal. The answer is nothing by mouth. Flashcard 32. Which of the following canes has 4 rubber-tipped feet? Think of the answer before the reveal. The answer is quad cane. Flashcard 33. In which of the following situations must a nursing assistant always wear gloves? Think of the answer before the reveal. The answer is while shaving a resident. Flashcard 34. Which type of toileting equipment is used for elimination for residents who cannot assist with raising their hips onto a regular bedpan? Think of the answer before the reveal. The answer is fracture pan. Flashcard 35. Hypertension is the medical term for. Think of the answer before the reveal. The answer is high blood pressure. Flashcard 36. How often should an ostomy bag be emptied? Think of the answer before the reveal. The answer is whenever stool is eliminated. Flashcard 37. How should an NA work when helping a resident with range of motion exercises? Think of the answer before the reveal. The answer is edging at the shoulders and work down the body. Flashcard 38. N blank is a permanent and painful shortening of a muscle or tendon. Think of the answer before the reveal. The answer is contracture. Flashcard 39. Which of the following is used when documenting the amount of fluid a resident drinks? Think of the answer before the reveal. The answer is milliliters. Flashcard 40. How should a fracture pan be positioned? Think of the answer before the reveal. The answer is with the handle toward the foot of the bed. Flashcard 41. In order to communicate with a resident who is hearing impaired, the nursing assistant should think of the answer before the reveal. The answer is face the resident directly when speaking. Flashcard 42. Which of the following is an example of physical abuse? Think of the answer before the reveal. The answer is pinching a resident. Flashcard 43. Joking with a resident's roommate about the resident's incontinence is what type of abuse? Think of the answer before the reveal. The answer is psychological abuse. Flashcard 44. Which of the following statements is true of mental illness? Think of the answer before the reveal. The answer is mental illness is a disorder that produces signs and symptoms like any physical disorder. Flashcard 45. An appropriate resource for an NA to turn to if he is experiencing stresses. Think of the answer before the reveal. The answer is his supervisor. Flashcard 46. In order for an object to be called clean in a healthcare setting, it must be. Think of the answer before the reveal. The answer is free of pathogens. Flashcard 47. Which of the following is an example of a whole grain food? Think of the answer before the reveal. The answer is whole wheat bread. Flashcard 48. The serious condition that occurs when a person does not have enough fluid in the body is called. Think of the answer before the reveal. The answer is dehydration. Flashcard 49. Which of the following is an example of a plant-based protein? Think of the answer before the reveal. The answers were fried beans. Flashcard 50. According to the USDA's My Plate, most fruit choices should be. Think of the answer before the reveal. The answer is whole fruit. Flashcard 51. Which of the following statements is true of helping to prevent aspiration during eating? Think of the answer before the reveal. The answer is the NA should place food in the stronger side of the mouth. Flashcard 52. Which of the following is true of transmission-based precautions? Think of the answer before the reveal. The answer is they are practiced in addition to standard precautions. Flashcard 53. An example of a physical restraint is. Think of the answer before the reveal. The answer is raised side rails on a bed. Flashcard 54. What does the abbreviation ADL stand for? Think of the answer before the reveal. The answer is activities of daily living. Flashcard 55. Which kind of care helps residents restore or improve function after an illness or injury? Think of the answer before the reveal. The answer is rehabilitation. Flashcard 56. The medical term for chest pain, pressure, or discomfort is. Think of the answer before the reveal. The answer is angina pectoris. Flashcard 57. An example of ethical behavior by an NA is. Think of the answer before the reveal. The answer is protecting a resident's privacy. Flashcard 58. Which of the following shows the correct conversion of 4 o'clock p.m. to military time? Think of the answer before the reveal. The answer is 1,600 hours. Flashcard 59. Barriers to communication include which of the following? Think of the answer before the reveal. The answer is NA uses medical terminology with the resident. Flashcard 60. Which of the following is an example of nonverbal communication? Think of the answer before the reveal. The answer is a resident points to a glass. Flashcard 61. Which of the following occurrences is considered an incident and requires a report to be completed? Think of the answer before the reveal. The answer is a resident falls. Flashcard 62. An employer must offer an NA a free vaccine for blank. Think of the answer before the reveal. The answer is hepatitis B. Flashcard 63. Draw sheets are used to. Think of the answer before the reveal. The answer is reposition residents without causing shearing. Flashcard 64. When assisting a resident with a standard bedpan, where should the wider end of the bedpan be placed? Think of the answer before the reveal. The answer is response in alignment with the resident's buttocks. Flashcard 65. Blood pressure is measured using a. Think of the answer before the reveal. The answer is response sphygmomanometer. Flashcard 66. One safety device that helps transfer residents is called a. Think of the answer before the reveal. The answer is response transfer belt. Flashcard 67. How many ounces of water or other fluids should residents be encouraged to drink each day? Think of the answer before the reveal. The answer is response 64 ounces. Flashcard 68. The medical term for skin that is blue or grey is. Think of the answer before the reveal. The answer is response cyanotic. Flashcard 69. Which of the following shows the correct conversion of midnight 12 o'clock am to military time? Think of the answer before the reveal. The answer is response 2,400 hours. Flashcard 70. The Omnibus Budget Reconciliation Act (OBRA) requires that nursing assistants complete at least blank hours of training before being able to work as nursing assistants. Think of the answer before the reveal. The answer is response 100. Flashcard 71. How many ounces are equal to 90 milliliters? Think of the answer before the reveal. The answer is response 3 ounces. Flashcard 72. Regular inspections performed in facilities to make sure they are following state and federal regulations are called. Think of the answer before the reveal. The answers. Response surveys. Flashcard 73. Which of the following is the best way for a nursing assistant to keep residents' health information confidential? Think of the answer before the reveal. The answer is response: store, file, or shred documents according to facility policy. Flashcard 74. What are typical duties of an ombudsman? Think of the answer before the reveal. The answer is response: an ombudsman advocates for residents and helps settle disputes. Flashcard 75. Which of the following topics is required by OBRA to be covered during nursing assistant NA training? Think of the answer before the reveal. The answer is response: promoting residents' independence. Flashcard 76. Which of the following behaviors promotes residents' rights? Think of the answer before the reveal. The answer is response: encouraging a resident to participate in care planning. Flashcard 77. Which of the following terms means harming a person physically, mentally, or emotionally by failing to provide needed care? Think of the answer before the reveal. The answer is response: neglect. Flashcard 78. Which of the following terms means to steal, take advantage of, or improperly use the money, property, or other assets of another person? Think of the answer before the reveal. The answer is response: financial abuse. Flashcard 79. OBRA was passed as a response to. Think of the answer before the reveal. The answer is response: reports of poor care and abuse in long-term care facilities. Flashcard 80. Tuberculosis is. Think of the answer before the reveal. The answer is response: an airborne disease. Flashcard 81. Which of the following statements is true of diabetes? Think of the answer before the reveal. The answer is response: people with diabetes must follow their diet instructions carefully. Flashcard 82. The most common form of diabetes is. Think of the answer before the reveal. The answer is response: type 2 diabetes. Flashcard 83. HIV can be transmitted by. Think of the answer before the reveal. The answer is response: blood. Flashcard 84. The key treatment for malignant tumors of the skin, breast, bladder, colon, rectum, stomach, and muscle is. Think of the answer before the reveal. The answer is response: surgery. Flashcard 85. Baseline vital signs are. Think of the answer before the reveal. The answer is response: initial values that can be compared to future measurements. Flashcard 86. Which of the following is the best way an NA can communicate with a resident who has cancer? Think of the answer before the reveal. The answer is response: that NA should listen to the resident if he feels like talking. Flashcard 87. Which of the following is an example of physically restraining a resident? Think of the answer before the reveal. The answer is response: putting both side rails up on the bed. Flashcard 88. A resident with AIDS who has an infection of the mouth may need to eat food that is. Think of the answer before the reveal. The answer is response: soft. Flashcard 89. To convert 4 ounces to milliliters, the NA should multiply 4 by. Think of the answer before the reveal. The answer is 30. Flashcard 90. Which of the following shows the correct conversion of 1,900 hours to standard time? Think of the answer before the reveal. The answer is response: 7 o'clock p.m. Flashcard 91. Where is long-term care offered? Think of the answer before the reveal. The answer is response: in skilled nursing facilities. Flashcard 92. Which of the following statements is true of urinary incontinence? Think of the answer before the reveal. The answer is response: certain nervous system diseases can cause urinary incontinence. Flashcard 93. After an amputation, a resident may experience phantom sensation. Phantom sensation is. Think of the answer before the reveal. The answer is response: the feeling that the amputated body part is still there. Flashcard 94. When should bed sheets be changed? Think of the answer before the reveal. The answer is response: when they are soiled or damp. Flashcard 95. Which of the following is a type of advance directive? Think of the answer before the reveal. The answer is response, durable power of attorney for healthcare. Flashcard 96 blank is taking in and eliminating equal amounts of fluid. Think of the answer before the reveal. The answer is response, fluid balance. Flashcard 97. What member of the care team might help a resident learn to use adaptive devices for eating or dressing? Think of the answer before the reveal. The answer is response, occupational therapist. Flashcard 98. When encountering a fire, an NA should first think of the answer before the reveal. The answer is response, remove residents from danger. Flashcard 99. Nursing assistants are not allowed to think of the answer before the reveal. The answer is response, change sterile dressings. Flashcard 100. A resident often carries a doll with her, treating it like her baby. One day she is wandering around crying that she can't find her baby. The nurse aide should A. ask the resident where she last had the doll. B. Ask the activity department if they have any other dolls. C. Offer comfort to the resident and help her look for her baby. D. Let the other staff know the resident is very confused and should be watched closely. Think of the answer before the reveal. The answer is C. Offer comfort to the resident and help her look for her baby. Flashcard 101. A nurse aide is asked to change a urinary drainage bag attached to an indwelling urinary catheter. The nurse aide has never done this before. The best response by the nurse aide is to think of the answer before the reveal. The answer is ask a nurse aide to watch the nurse aide change the bag since it is the first time. Flashcard 102. Before feeding a resident, which of the following is the best reason to wash the resident's hands? A. The resident may still touch his or her mouth or food. B. It reduces the risk of spreading airborne diseases. C. It improves resident morale and appetite. D. The resident needs to keep meal routines. Think of the answer before the reveal. The answer is A. The resident may still touch his or her mouth or food. Flashcard 103. Which of the following is a job task performed by the nurse aide? A. Participating in resident care planning conferences. B. Taking a telephone order from a physician. C. Giving medications to assigned residents. D. Changing sterile wound dressings. Think of the answer before the reveal. The answer is A. Participating in resident care planning conferences. Flashcard 104. Which of the following statements is true about range of motion exercises? A. Done just once a day. B. Help prevent strokes and paralysis. C. Require at least 10 reps of each exercise. D. Are performed during adults such as bathing or dressing. Think of the answer before the reveal. The answers D. Are performed during adults such as bathing or dressing. Flashcard 105. While the nurse aide tries to dress a resident who is confused, the resident keeps trying to grab the hairbrush. The nurse aide should have put the hairbrush away and out of sight. B. Give the resident the hairbrush to hold. C. Try to dress the resident more quickly. D. Restrain the resident's hand. Think of the answer before the reveal. The answer is B. Flashcard 106. A resident who is lying in bed suddenly becomes short of breath. After calling for help, the nurse aide's next action should be to ask the resident to take deep breaths. B. Take the resident's vital signs. C. Raise the head of the bed. D. Elevate the resident's feet. Think of the answer before the reveal. The answer is C. Flashcard 107. A resident who has cancer is expected to die within the next couple of days. Nursing care for this resident should focus on helping the resident through the stages of grief. B. Providing for the resident's comfort. C. Keeping the resident's routine, such as forbathing. D. Giving the resident a lot of quiet time. Think of the answer before the reveal. The answer is B. Flashcard 108. While giving a bed bath, the nurse aide hears the alarm from a nearby door suddenly go off. The nurse aide should wait a few minutes to see if the alarm stops. B. Report the alarm to the charge nurse immediately. C. Make the resident being bit safe and go check the door right away. D. Stop the bed bath and go check on the location of all assigned residents. Think of the answer before the reveal. The answer is C. Flashcard 109. Gloves should be worn for which of the following procedures? A. Emptying a urinary drainage bag. B. Brushing a resident's hair. C. Ambulating a resident. D. Feeding a resident. Think of the answer before the reveal. The answer is A. Flashcard 110. When walking a resident A gate or transfer belt is often worn around the nurse aid's waist for back support. B. Used to keep the resident positioned properly in the wheelchair. C. Used to help stand the resident and then removed before walking. D. Put around the resident's waist to provide a weight to hold on to the resident. Think of the answer before the reveal. The answer is D. Flashcard 111. Which of the following statements is true about residents who are restrained? A. They are at a greater risk for developing pressure sores. B. They are at a lower risk for developing pneumonia. C. Their posture and alignment are improved. D. They are not at risk for falling. Think of the answer before the reveal. The answer is A. Flashcard 112. A resident had diabetes. Which of the following is a common sign of a low blood sugar? A. Fever. B. Shakiness. C. Thirst. D. Vomiting. Think of the answer before the reveal. The answer is B. Shakiness. Flashcard 113. When providing foot care to a resident, it is important for the nurse aide to remove calluses and corns. B. Check the feet for skin breakdown. C. Keep water cool to prevent burns. D. Apply lotion, including between the toes. Think of the answer before the reveal. The answer is B. Flashcard 114. When feeding a resident, frequent coughing can be a sign the resident is choking. B. Getting full. C. Needs to drink more fluids. D. Having difficulty swallowing. Think of the answer before the reveal. The answer is D. Flashcard 115. When a person is admitted to the nursing home, the nurse aide should expect that the resident will have problems related to incontinence. B. Require a lot of assistance with personal care. C. Experience a sense of loss related to life change. D. Adjust more quickly if admitted directly from the hospital. Think of the answer before the reveal. The answer is C. Flashcard 116. A resident gets dressed and comes out of his room wearing shoes that are from two different pairs. The nurse aide should think of the answer before the reveal. The answer is ask if the resident realizes that the shoes do not match. Flashcard 117. A resident's wife, J, has died. The resident is now staying in room all the time. No eating. What should nurse aide do? A. Remind the resident to be thankful for the years spent with his wife. B. Tell the resident that he needs to get out of his room at least once a day. C. Understand the resident is grieving and give him chances to talk. D. Avoid mentioning his wife when caring for him. Think of the answer before the reveal. The answer is C. Flashcard 118. When a resident refuses a bed, the nurse aide should offer the resident a bribe. B. Wait a while and then ask the resident again. C. Remind the resident that people who smell don't have friends. D. Tell the resident that nursing home policy requires daily bathing. Think of the answer before the reveal. The answer is B. Flashcard 119. When a resident is combative and trying to hit the nurse aide, it is important for the nurse aide to assure the resident that the nurse aide is in control. B. Call for help to make sure there are witnesses. C. Explain that if the resident is not calm, a restraint may be applied. D. Step back to protect self from harm while speaking in a calm manner. Think of the answer before the reveal. The answer is D. Flashcard 120. During lunch in the dining room, a resident begins yelling and throws a spoon at the nurse aide. The best response by the nurse aide is to remain calm and ask what is upsetting the resident. B. Begin removing all the other residents from the dining room. C. Scold the resident and ask the resident to leave the dining room immediately. D. Remove the resident's plate, fork, knife, and cup so there is nothing else to throw. Think of the answer before the reveal. The answer is A. Flashcard 121. Which of the following questions asked to the resident is most likely to encourage conversation? A. Are you feeling tired? B. Do you want to wear this outfit? C. What are your favorite foods? D. Is the water warm? Think of the answer before the reveal. The answer is C. Flashcard 122. When trying to communicate with a resident who speaks a different language than the nurse aide should use pictures and gestures. B. Face the resident and speak softly when talking. C. Repeat words often if the resident does not understand. D. Assume when the resident nods his or her head that the message is understood. Think of the answer before the reveal. The answer is A. Flashcard 123. While walking down the hall, a nurse aide looks into a resident's room and sees another nurse aide hitting a resident. The nurse aide is expected to contact the state agency that inspects the nursing facility. B. Enter the room immediately to provide for the resident's safety. C. Wait to confront the nurse aide when he/she leaves the resident's room. D. Check the resident for any signs of injury after the nurse aide leaves the room. Think of the answer before the reveal. The answer is B. Flashcard 124. Before touching a resident who is crying to offer comfort, the nurse aide should consider the resident's recent vital signs. B. The resident's cultural background. C. Whether the resident has been sad recently. D. Whether the resident has family that visits routinely. Think of the answer before the reveal. The answer is B. Flashcard 125. When a resident is expressing anger, the nurse aide should A. Correct resident's misperceptions. B. Ask resident to speak in a kinder tone. C. Listen closely to resident's concerns. D. Remind resident that everyone gets angry. Think of the answer before the reveal. The answer is C. Listen closely to resident's concerns. Flashcard 126. When giving a back rub, nurse aide should A. Apply lotion to the back directly from the bottle. B. Keep resident covered as much as possible. C. Leave extra lotion on skin when completing the procedure. D. Expect resident to lie on his or her stomach. Think of the answer before the reveal. The answer is B. Keep resident covered as much as possible. Flashcard 127. A nurse aide finds a resident looking in the refrigerator at the nurse's station at 5 a.m. The resident, who is confused, explains he needs breakfast before he leaves for work. The best response by the nurse aide is to A. Help resident back into his room and back to bed. B. Ask resident about his job and if he is hungry. C. Tell him that residents are not allowed in the nurse's station. D. Remind him that he is retired from his job and in a nursing home. Think of the answer before the reveal. The answer is B. Flashcard 128. Which of the following is true about caring for a resident who wears a hearing aid? Apply hairspray after hearing aid is in place. B. Remove hearing aid before showering. C. Clean ear mold and battery case with water daily, drying completely. D. Replace batteries weekly. Think of the answer before the reveal. The answer is B. Flashcard 129. Residents with Parkinson's disease often require assistance with walking because they A. Become confused and forget how to take steps without help. B. Have poor attention skills and do not notice safety problems. C. Have visual problems that require special glasses. D. Have shuffling walk and tremors. Think of the answer before the reveal. The answer is D. Flashcard 130. A resident who is inactive is at risk of constipation. In addition to increased activity and exercise, which of the following actions helps to prevent constipation? A. Adequate fluid intake. B. Regular meal times. C. High protein diet. D. Low fiber diet. Think of the answer before the reveal. The answer is A. Flashcard 131. A resident has an indwelling urinary catheter. While making rounds, the nurse aide notices that there is no urine in the drainage bag. The nurse aide should first A. Ask the resident to try urinating. B. Offer the resident's fluid to drink. C. Check for kinks in the tubing. D. Obtain a new urinary drainage bag. Think of the answer before the reveal. The answer is C. Flashcard 132. A resident who is incontinent of urine has an increased risk for developing A. Dementia. B. Urinary tract infections. C. Pressure sores. D. Dehydration. Think of the answer before the reveal. The answer is C. Flashcard 133. When cleansing the genital area during pericare, the nurse aide should A. Cleanse penis with circular motion starting from the base and moving toward the tip. B. Replace the foreskin when pushed back to cleanse an uncircumcised penis. C. Cleanse the rectal area first before cleansing the genital area. D. Use the same area on the washcloth for each washing and rinsing stroke for a female resident. Think of the answer before the reveal. The answer is B. Flashcard 134. Which of the following is considered a normal age-related change? Dementia. B. Contractures. C. Bladder holding less urine. D. Wheezing when breathing. Think of the answer before the reveal. The answer is C. Flashcard 135. A resident is on a bladder restraining program. The nurse aide can expect the resident to A. Have a fluid intake restriction to prevent sudden urges to urinate. B. Wear an incontinent brief in case of an accident. C. Have an indwelling urinary catheter. D. Have a schedule for toileting. Think of the answer before the reveal. The answer is D. Have a schedule for urinating. Flashcard 136. A resident who has stress incontinence (A) will have an indwelling catheter (B), should wear an incontinent brief at night. C. May leak urine when laughing or coughing. D. Needs toileting every 1 minute 2 hours throughout the day. Think of the answer before the reveal. The answer is C. May leak urine when laughing or coughing. Flashcard 137. The doctor has told the resident that his cancer is growing and he is dying. When the resident tells the nurse aide that there is a mistake, the nurse aide should (A) understand that denial is a normal reaction. B. Remind the resident that the doctor would not lie. C. Suggest the resident to ask for more tests. D. Ask if the resident is afraid of dying. Think of the answer before the reveal. The answer is A. Understand that denial is a normal reaction. Flashcard 138. A slipknot is used when securing a restraint so that (A) the restraint cannot be removed by the resident. B. The restraint can be removed quickly when needed. C. Body alignment is maintained while wearing the restraint. D. It can be easily observed whether the restraint is applied correctly. Think of the answer before the reveal. The answer is B. The restraint can be removed quickly when needed. Flashcard 139. When using personal protective equipment (PPE), the nurse aide correctly follows standard precautions when wearing A. Double gloves when providing peri-care to a resident. B. A mask and gown while feeding a resident that coughs. C. Gloves to remove a resident's bedpans. D. Gloves while ambulating a resident. Think of the answer before the reveal. The answer is C. Flashcard 140. To help prevent resident falls, the nurse aide should A. Always raise side rails when any resident is in his or her bed. B. Leave residents' beds at the lowest level when care is complete. C. Encourage resident to wear larger sized, loose-fitting clothing. D. Remind resident who use call lights that they need wait patiently for staff. Think of the answer before the reveal. The answer is B. Leave resident's bed at lowest level when care is complete. Flashcard 141. As the nurse aide begins his or her assignment, which of the following should nurse aide do first? Collect linen supplies for the shift. B. Check all nurse aides assigned residents. C. Assist a resident that has called for assistance to get off the toilet. D. Start bathing a resident that has physical therapy in 1 hour. Think of the answer before the reveal. The answer is C. Assist a resident that has called for assistance to get off the toilet. Flashcard 142. Which of the following would affect a nurse aide's status on the state's nurse aide registry and also cause the nurse aide to be ineligible to work in a nursing home? A. Having been terminated from another facility for repeated tardiness. B. Missing a mandatory infection control and service training program. C. Failing to show up for work without calling to report the absence. D. Having a finding for resident neglect. Think of the answer before the reveal. The answer is D. Having a finding for resident neglect. Flashcard 143. To help prevent the spread of germs between patients, nurses aides should A. Wear gloves when touching residents. B. Hold supplies and linens away from their uniforms. C. Wash hands for at least 2 minutes after each resident contact. D. Warn residents that holding hands spreads germs. Think of the answer before the reveal. The answer's B. Hold supplies and linens away from their uniforms. Flashcard 144. When a sink has hand control faucets, the nurse aide should use A. Paper towel to turn the water on. B. A paper towel to turn off the water. C. An elbow, if possible, to turn the faucet controls on and off. D. Bare hands to turn the faucet controls both on and off. Think of the answer before the reveal. The answer is B. Flashcard 145. When moving a resident up in bed who is able to move with assistance, the nurse aide should A. Position self with knees right and bend at waist. B. Use a gate or transfer belt to assist with the positioning. C. Pull the resident up holding onto one side of the draw sheet at a time. D. Bend the resident's knees and ask the resident to push with his or her feet. Think of the answer before the reveal. The answer is D. Bend the resident's knees and ask the resident to push with his or her feet. Flashcard 146. The resident's weight is obtained routinely as a way to check the resident's A. Growth and development. B. Adjustment to facility. C. Nutrition and health. D. Activity level. Think of the answer before the reveal. The answer is C. Nutrition and health. Flashcard 147. Which of the following is a right that is included in the Resident's Bill of Rights? A. To have staff available that speak different languages on each shift. B. To have payment plans that are based on financial needs. C. To have religious service offered at the facility daily. D. To make decisions and participate in own care. Think of the answer before the reveal. The answers: D. To make decisions and participate in own care. Flashcard 148. Which of the following, if observed as a sudden change in the resident, is considered a possible warning sign of a stroke? A. Dementia. B. Contractures. C. Slurred speech. D. Irregular heartbeat. Think of the answer before the reveal. The answer is C. Slurred speech. Flashcard 149. Considering the resident's activity, which of the following sets of vital signs: temp, pulse, respiration, blood pressure should be reported to the charge nurse immediately? A. Resting 98.6-98-32/140 B. After eating 97-64-24/120 C. After walking exercise 98.2-98-28/125 D. While watching television 98.8-72-14/110 Think of the answer before the reveal. The answer is A. Resting high respirations 98.6-98-32/140 Flashcard 150 of the following, which is most likely due to an infection in the resident? A. Pale skin. B. Tented skin. C. Sudden onset confusion. D. Aphasia. Think of the answer before the reveal. The answer is C. Sudden onset confusion. Tinted or tented skin is normal, and pale skin aphasia could indicate stroke. Flashcard 151. Which of the following would be a primary indication of hepatitis? Think of the answer before the reveal. The answer is jaundice. Flashcard 152. Cheyne-Stokes respiration occurred in a client who? Think of the answer before the reveal. The answer is as close to death. Flashcard 153. Axellopresent applied technology. Think of the answer before the reveal. The answer is something that helps you fly. Flashcard 154. When helping a client with left-sided weakness due to CVA, where should you give the cane? Think of the answer before the reveal. The answer is right side to support the weak side. Flashcard 155. CPR should be performed on a victim who is? Think of the answer before the reveal. The answer is no pulse and not breathing. Flashcard 156. Log rolling is a technique best used for which of the following patient diagnoses? A left tibial fracture. B. Spinal cord injury. C. Cellulitis of the right arm. D. Psychosis. Think of the answer before the reveal. The answer is B. Flashcard 157. Log rolling is a method of moving patients with suspected a head injury. B. Spinal injury. C. Bowel obstruction. D. Extremity fracture. Think of the answer before the reveal. The answer is spine. Flashcard 158. Which of the following types of grief is considered a normal and healthy part of grieving? Anticipatory. B. Complicated. C. Unresolved. D. Inhibited. Think of the answer before the reveal. The answer is A. Flashcard 159. Battery and assault. Think of the answer before the reveal. The answer is battery is an unprivileged, unwanted touching of another. Flashcard 160. MRSA. Think of the answer before the reveal. The answer is resistant to antibiotics. Flashcard 161. Fecal impaction, also known as. Think of the answer before the reveal. The answer is bowel obstruction. Flashcard 162. Dyspnea. Think of the answer before the reveal. The answer is difficulty breathing. Flashcard 163. The resident burns foot on George Foreman grill. It looks blistered and red. What kind of burn is this? Think of the answer before the reveal. The answer is partial thickness burn. Total thickness would appear waxy and white. Superficial would be blotchiness and no blistering. Flashcard 164. A client who has not had a bowel movement in 4 days would receive the most benefit from which procedure? Think of the answer before the reveal. The answer is enema. Flashcard 165 Poo-poo Skloopoo. Think of the answer before the reveal. The answer is B. Flashcard 166 Chicken Waffle Ire. Think of the answer before the reveal. The answer is Iskoisk. Flashcard 167 Portland. Think of the answer before the reveal. The answer is chicken. Flashcard 168 Divk. Think of the answer before the reveal. The answer is beeful. Flashcard 169. I once heard a joke about amnesia. Think of the answer before the reveal. The answer is, but I forgot how it goes. Flashcard 170 Poople Skoople. Think of the answer before the reveal. The answer is our PDM processing unit.